Hello and welcome to episode 19 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is good rehab. Is it going to be hard rehab? Should it be easy? How difficult or complex should it be? And how do you know ultimately what rehab is going to work for you? Now, if you tuned in on last week's episode or the last episode, episode 18, we discussed how to return to running without low back pain. Now, this is a concept that many of you need to understand because many of you are trying to get back to running who are struggling with low back pain, who want to run without low back pain. But also we discussed the rehab and load management strategies to get back to exercise in general. It doesn't have to be running. It could be kayaking. It could be working out in the gym, whatever. The application is widespread. However, in that podcast, I discussed how before you get to the later stages of that rehab process, that of course you have to have the right rehab movements to address the root of the issue first. You have to restore your range of motion. You have to reduce that sciatica. You have to make that disc happy again. You have to accomplish that first before you can really get back into the exercise, into the things that you love, back to at least your full capabilities, I should say. So today's topic is really going to kind of address that. What does good rehab look like? So the first thing I'm going to say, and some of you may be like, oh my gosh, that's kind of surprising. Many of my own online clients in my online low back program, the initial phases that we start with, a lot of individuals will message me throughout week 1, week 2 in our program, and they'll say something along the lines of, hey Grant, I think I'm ready for more. This seems a little bit easy. It doesn't feel like I'm doing much. I'm looking for something harder. These are messages that I get. And I'm going to talk you through a discussion that I have with a lot of my clients, which is, does it need to be hard? And sometimes we get some interesting answers and it kind of goes, well, what do you mean? So let's talk through this a little bit, okay? Good rehab does not need to be hard rehab. Good rehab is rehab that gets you results. If you can get results, now I'm making up a ridiculous scenario here, but if you can get results doing as little as possible, but is going to be the most effective and efficient of your time, that's an ideal scenario. That is an ideal scenario. So we all know that, here's the ridiculous analogy. We all know that to truly lose weight and be a healthy person, you got to put in work. You got to get in the gym. You got to eat right. You have to take the initiative. But if there was a magic pill that everyone's looking for, right? If there was a magic pill where you could just take it, you could just sit on the couch all day, and magically you would lose weight, your blood work would improve, you would get stronger, your body would become more mobile, your joints, ligaments, and tendons would all become healthier and stronger, then obviously that would be an ideal scenario. If you can accomplish exactly what you would by going to the gym, by going on your runs, by putting in the work in the kitchen, eating right, monitoring the amount of food you're consuming, if you could get all of the health benefits of that from a pill and sitting on the couch, it's a no-brainer that you would take the pill and sit on the couch. It's a no-brainer because you'd have more time to focus on your business or your other goals or your family or whatever. It's a no-brainer, right? It's never going to happen, but it's a no-brainer. So let's take that into our low back coaching, okay? I speak with individuals. I've spoken with many individuals. A couple are professional athletes who were used to doing 1 hour to 2 hours of rehab every day. And they weren't seeing significant improvement. They were maintaining. That was enough to keep them the same. But they were doing 1 hour to 2 hours of stretches and movements every single day. I'm telling you right now, that is insane. If you are doing anything near that to try to just maintain, it's the wrong things. Anyone can move around for 1 hour and feel better. It's called warming up, right? If you warm up your body, you're going to feel a little bit better. That's what 1 hour to 2 hours of rehab is going to do. It's going to warm you up. That is not effective. If you are doing anything near that, it's not the right movement. So Sometimes these individuals who are used to doing so much, they feel like they have to be doing a lot in order to get results, right? Like if they're doing 2 hours on their own and they hire me as their coach, they're like, well, if 2 hours isn't even enough to get progress, I'm sure I'm going to be doing something more or something even harder to get more progress. And they work with me, and week 1, week 2, they might be doing 10 minutes of rehab a day. That's it. And they're like, what? This can't be the case. I was doing 2 hours and it wasn't getting me anywhere. How is 10 minutes going to do anything for me? Well, this is the point in this podcast or YouTube video where you go to my Instagram account, you scroll through my testimonials, and you see how much improvement people get just during the assessment itself. I've had some people get 50% improvement in the range of motion sciatica within 5 minutes. When you do the right movements, you get results. It doesn't matter how much you're doing, how long you're doing your rehab. If it's the wrong rehab, you're not going to get anything from it. The goal is to find the exact movements for you that are the most specific, so you don't need to waste your time on all these other things. Another analogy I give all the time is, let's say you have a gut-related issue. Let's say some doc gives you 10 different medications for that, but only one of them is the one that's actually going to be effective. It's a certain probiotic or prebiotic or whatever. Okay, that's the medication that's going to be the most effective, but he gives you 10. Would you rather take 10 medications where, one of them is accounting for 90% of the improvement? Or would you rather take the one that's going to get you 90% of the improvement? Take the one. Don't waste your time doing all the others. Don't mess with your body. Do the one that's going to get you the most results. It's the same thing with proper rehab. Good rehab does not mean hard rehab. If I wanted to make you sweat or make you feel like you were working hard for your low back progress, well, then I would just tell you to do burpees and planks. That'll make you sweat. That'll make you work hard. Is that good rehab? No, it's not. My job is to save you time, to save you money, and to give you the right rehab. So if you're doing 10 minutes of rehab a day, but you're getting results, then you're winning. You're winning immensely. There's no reason to do any more. You don't need to. If you're getting significant results every week, which we should, you should be seeing significant results within 1 to 2 weeks if you have the right rehab plan. It should be quite dramatic at times. Then who cares? Would you rather do 10 minutes of simple rehab or an hour of hard rehab, hard in quotes? That's going to make you sweat. That's going to tax you. That requires bands, that requires balancing balls and exercise balls and all these things. But the result's going to be the same? No. Who would choose that second option? If you want to take another 50 minutes just to do complex stuff, then just go to the gym and work out. Go get your body fit. We don't need to do 50 minutes of unnecessary things to get you to where you want to be. We should stratify the movements that are going to be the most effective and only spend our time on that. That's good rehab. Good rehab is not hard rehab. It should not be complex. If it's complex and it's something that you can only perform in a unique scenario with unique equipment, then it's not good rehab because it's not applicable to your life. Good rehab is rehab you can do anywhere, anytime, because it has to relate to your lifestyle. If I'm working with a client that is in construction or that has an office job or that is a hairstylist, and I'm telling them, hey, you're hiring me because you want to learn movements that you can do on your own to fix yourself and to keep yourself healthy, right? That's why everybody comes to me. But I'm giving them an exercise that requires equipment, that requires specific scenarios, that requires a whole bunch of production. They can't do those at work. They can't do those, in their environment. They could only do those maybe at home if they have the equipment or maybe at the gym. That's it. What good is that? Now, if we're talking about later stages of rehab where they're recovered, they are in control of these issues, they're in a really good spot, and they're just wanting to progress some exercises in the gym, that's a very different scenario. I'm talking about someone who's in the earlier stages. Reduced range of motion, they have pain, they have sciatica, these things. The rehab has to be simple. It needs to be applicable to their life. If they can't implement it in their daily life and they can't implement it easily, it's not good rehab. Because They're not going to be able to do it. Their compliance will be low. It's impractical. It's not realistic. You need to be able to apply it to your everyday life, and it should not be some hard, complex thing that's making you sweat and grunt and really, really work hard. I've never had to do that. I've never had to make someone sweat to fix their low back. It just hasn't ever happened. It will never happen. It will never be necessary. Good rehab is not hard rehab. So what I encourage you to do, and what I tell my clients who bring this up to me as well, is when you feel like, I feel like I should be doing more, like I need something harder, like take a step back and think, okay, am I getting results? If you are getting results, then that's all that matters. Results. Feeling better is what matters. That's what matters. Now, you should have a phase in your program where there is a transition to harder movements, but that should be after you're feeling solid. Okay, so there is a point at which I take all of my clients through squatting procedures, deadlifting procedures, more advanced core movements, and of course, I help them get back to whatever activity it is they're doing, and we add in additional movements and things like that. Like, that's going to be a part of it. Like, it will get harder. It should get harder. Eventually, your rehab should resemble an exercise program. Down the road, it should. That is how it should look. But once again, I'm talking about the earlier acute stages. All right? It doesn't need to be hard. It doesn't need to be complex. It should be simple, effective, and applicable to your everyday life and realistic for what you can fit in, because that's what's going to make it effective. That's what's going to make it maintainable so that you can maintain the results for the rest of your life. You should be able to do it anytime, anywhere. You should see fast results with it, and it does not have to be hard. Simple movements, little movements that you're like, what? That's really going to help. And it does. It does by a lot. Those are the kind of movements you want to find. And those are the kind of movements that we find, especially in individuals with disc herniation and sciatica. Typically, we find a couple really, really, really easy movements to start with that will produce results like that. You know, significant reduction in leg symptoms and pain within the first week or two. That's typically what we find. That's good rehab. Not telling someone, all right, you got to go do an hour of this and this and this and this and this and this and this, and, you know, buy this equipment and lay on this contraption for a while. That's not good stuff. Okay. So whether you are in a rehab program right now or not, evaluate where your current plan is. If you're currently in a rehab program, evaluate how much you're being asked to do and if it's effective. If you're not getting results, it's not worth it. You need to restructure it and find the movements that are going to be right, or, you know, find a different coach, find a different provider, find someone else to help. If you feel like, if you've been spinning your tires for a while, if you've been going there multiple weeks, multiple months, and you're not significantly improved, it's the wrong thing. I'm telling you right now, it's the wrong thing. Most of my clients are pain free by the halfway mark. Okay. If you're not seeing significant improvements within 1 to 2 weeks, you're not doing the right things. If you are not currently in a rehab program, but you know you should be, then make sure as you seek out help, whether that's with me or anybody else, make sure you evaluate what they're having you do. Is it something you can do on your own? It should be, because you need to be empowered. Is it something you can, for the most part, do anytime, anywhere? Is it easy to fit into your lifestyle? Is it simple and easy to abide by? Will your compliance be high with it? Or are they asking you to do a whole bunch of stuff? They give you that packet, right, of exercises, of 20 different exercises, and it requires bands and all these other things from the start. That's overwhelming. It's probably not going to be the most ideal route, probably not the most optimal. So I hope you learned something from this podcast. I hope you understand a little bit more about how rehab should look, how you can determine what's going to be right for you, and what's going to be most effective. And if you learned something from this podcast, please leave a rating, leave a review on Apple. It helps me immensely, and it's a zero-cost way for you to help support me. Also, if you are on YouTube, please like, comment, and subscribe. That is also a zero-cost way to help support me and help me continue to do these episodes. And if you're learning things from them, please leave comments. Let me know what you learned. Let me know what you enjoyed. Let me know what future topics you would like me to cover, because I want to keep doing this and I want to know that you guys are getting something from it. And I want to know that I'm helping you. So if you're struggling with low back issues, or you know anyone who is struggling with low back issues, please share this video with them or get them in touch with me so I could have the amazing opportunity to help you or your loved ones. I would be honored, and I love what I do, and I love making rehab simple and effective so that you can get back to the things that you love. Thank you so much for listening, and have a great day.